Hello viewers, this is the Open Pulpit. The last issue we talked about has to do with defensive health issues for men. Today we are going to discuss defensive health issues for women. And because people may watch this episode differently, I still want my people here to introduce themselves, beginning with you, ma'am.
Hello, my name is Sylvia Nobore. I am a family nurse practitioner as well as women's health nurse practitioner.
Welcome to this episode, ma'am.
Thank you.
Hi, hello everybody. My name is Sheung Ogunjimi. I'm a family nurse practitioner as well, and I'm also a college instructor.
Okay, so now let's start from the beginning. The first fundamental question I want to ask is, do women have more health issues than men? Do they?
I think so. I think women, it could vary, but I think women have more health issues than men. And one of the common health issues is heart disease. 1 in 4 women die from a heart disease or are diagnosed with a heart disease in the United States. So, and they say women multitask with a lot of things. So that comes with a lot of other chronic conditions as well, because they put other people ahead of them and they don't really take care of themselves. So by the time they go to the hospital, they have more complications.
So what are the commonest health issues that women have?
Well, the first is the heart disease. So we have other heart disease. We have the hypertension, high cholesterol, diabetes. We have a lot of breast cancers, ovarian cancers, cervical cancers, and all other things.
Wow.
Yeah.
Cancer. Okay, so what prevention can women do to ensure that they do not fall victims of these diseases you are talking about?
I think the first thing is just lifestyle. That's important. Health is wealth. So if you want to prevent any form of chronic conditions, heart disease, you have to exercise. That is the recommendation. You have to eat healthy to prevent. Sometimes there's a predisposed, like family history of heart disease. Also living in the United States, you're also predisposed to certain things based on the dietary intake. So if you're eating healthy, you're exercising, you can decrease your risk of being exposed to heart disease as well.
Amen. I want us to specifically identify some of the commonest health issues that women do have and how to handle it or how to manage such health issues if they are not able to prevent it.
Also hypertension. So just like Sylvia had said, Sylvia had mentioned that there is a genetic predisposition to some of these diseases. So you can't. So what it means is that you don't have any power over it. It's not you. It's not your fault that your family had it or your grandmother, your great grandmother had it. But what you could do, because hypertension is a very slow killer. It comes slowly and it kills very fast. So another things that comes with hypertension will be diabetes, and other things that comes with that will be your kidneys will begin to shut down. So you want to make sure that you're checking your blood pressure regularly. And how do you do that? You go to your doctor. And the good news, if you're living in the United States, there are so many other like pharmacies that have corners where you can actually do your blood pressure. You can go to walk-in clinics where you can have them check your blood pressure for you, because ordinarily you probably wouldn't know that your blood pressure is high. But one of the signs is that you start getting headaches, right?
Like
They
the
could have
headache.
headache.
You start
Yeah,
getting
at the
headaches.
back of your head.
If you start having headaches,
Wait
that
a
is
minute.
unusual. You should.
Headache at the back of the head?
Yes. So
Is there a difference between headache
Yes.
frontal
Yeah.
and headache?
yes.
Wow.
Yes.
What's the difference?
So usually if you have, it's called occipital headaches. If it's persistent, it doesn't matter if you've eaten, it's still there. I would recommend checking your blood pressure,
Yeah,
especially if you're African, your diet has salt in it. So you would need to cut out salt. And there's also something called tension headache. There's migraine headaches. It's completely different from hypertensive headaches as well. And there's a different type of headaches that if it's a thunderclap, it feels like somebody literally hit your head. And that's also concerning from brain bleed. So if you have uncontrolled hypertension, that can also be a reason as well.
So How can we identify or tell us the symptoms of some of these diseases that are commonest with women?
I mean, women, it's the problem with women's health is that many of these conditions, the signs are insidious. They come slowly and they are not, they're atypical. They're not usually the kind of signs you see in every other person. So what I will say is, just like Sylvia said, if you feel something that is abnormal, you have a headache, probably the worst headache of your life, or like a headache that is different from what you had yesterday or that you will have on a day-to-day basis, you want to check yourself out right away. You start having like acid reflux, something that looks like, oh, I'm just having this weakness that I've never had before, my arms hurt or something. It could be you getting into stroke, actually. So you want to go to the hospital or go to the clinic near you, just at least have yourself checked out. So make sure that everything is fine, because women, we present differently than men in all things, differently than men.
Well, at the beginning of this discussion, you mentioned a series of cancer, ovarian cancer, something cancer. Can you identify one or two and let's know how best for women to detect early and manage it? Any of the cancers, mention them one by one, please.
I think breast cancer, the way to kind of detect, I think we've talked about this in church a couple of years ago. The recommendation is a monthly self-breast exam. You know your body more than you do, but sometimes it's your body, so you kind of forget that it's there. So if you're taking a shower, you just check. If you don't feel comfortable checking, you can have your partner check. And that starts at the age of 30, just the
Check, or
self-breast.
how do you check? Is my question. You use an instrument or something?
No, your hands.
Oh, okay.
So you're using the 4 pads or the 3 pads of your hands to you're just manually palpating. It shouldn't hurt. So before your period, it will be tender. So if it's not before your period and it's tender, you have, let's say you lift up one arm, one boob is up, the other one is down. That is abnormal. If you're not breastfeeding, you have breast or nipple discharge. Some women have fibroadenoma, which is called just dense, like fatty breast. That's normal. But if you're touching your breast and it's painful and it's hard, that's abnormal. You need to go in. So that's why we have mammograms starting at the age of 40. But if you have a first degree relative, so your mother, your auntie, or your grandmother with a history of breast cancer, the recommendation is to get mammogram screening earlier than the age of 40. So that's one way of kind of diagnosing breast cancer. So the monthly self-breast exams and mammograms starting at the age of 40.
That's breast cancer.
Correct.
Thank you. How about ovarian cancer that you mentioned earlier on?
Well, unfortunately, ovarian cancer is
Or what is ovarian cancer?
the cancer of the ovaries. So it's more internal, and
Okay.
it's a growth that usually before they catch it, it's usually mostly too late, because so hopefully some of those diseases are just so bad that sometimes there's nothing anyone can do to prevent them. But the ones that you can prevent, and the other thing is when you go for your annual checkup. So when they do all these checkups, sometimes they call them incidental findings.
Yeah.
They could find something which will trigger. Let's go for more tests. Let's do an X-ray. Let's do an MRI, and they will find some of these cancers in the body just from regular checkup. And that's why we ask that we do checkup. Pap smear is one of the ones to avoid cervical cancer. When you do pap smear regularly, per guidelines, your OBGYN will let you know when you are supposed to go in for your pap smear. But you need to go in. They go in, they check. It's not painful at all. They just take a little specimen, check it out under the microscope to make sure that everything is normal. If it's abnormal, they will do further tests. So that's how you kind of catch that early.
How regularly should a woman do that kind of check to be L3?
Okay, so there's something called Well Woman Exam. It's every year. It doesn't necessarily include a pap smear, because if the guideline is 3 to 5 years, if you have a history of regular pap smears. But there are certain things you can't really see with your own eyes. So sometimes you need to go in at least once a year. That could be a doctor's appointment once a year to just get a once-over check. If you're good, see you in 1 year. Right.
So, okay, we talk about breast cancer and ovarian cancer. Is there any other common cancer that women can experience, can suffer from?
I mean, there are so many kind of cancers but it's kind of like fair play. It goes men, women, pancreatic cancer, we have lung cancer, but those are all like across the board. And so lung cancer, if you're smoking, puts you at a higher risk for getting that. But the ones that are most pertinent to women are the
The
breast
breast
cancer,
cancer, and
ovarian,
ovarian.
and cervical.
Thank you so much, viewers. I'm glad you are listening to all this, and I pray that we will take the best advantage of this kind of counseling that we are having on the open pulpit. Now, the question is this, which I want to ask: how do we help a woman that has any of these diseases, psychologically, emotionally, spiritually? What kind of help can we render to such a patient?
I think a lot of people are scared of the cancer word. But I don't, it's not a death sentence, especially as a Christian. So I think you're working everything with faith. Go to your doctor for sure. And when you go to the doctor, that's not when they diagnose. You already have what you have. Okay? They're just finding out and then they're trying to help. And I know sometimes fear comes in and it makes you kind of hesitate and feel as if, okay, what else to do? But in your fear, that's when you're supposed to step up, and be proactive about getting better. And the doctors are available to help. Also, it's also great to seek second opinion if you don't agree. Seek second opinion, but also you're keeping God closely. But you cannot just hold God in one hand and not do something, right? So you have to hold God and also
watch and pray.
Watch and pray, yeah. So you have to trust God, and then also you're working hand in hand with your medical doctor, and it gets better. It does.
How can a woman who is going through this kind of situation be helped? Say by her husband, for example. How can she be helped?
I'm hoping that everybody gets the kind of support that they need in terms of troubles like this, because this is when we talk of cancers, it's a big deal, and a woman who is going through that kind of a disease needs all the help. So I'm hoping that they have a supportive partner. I believe that is where the for better for worse comes in, where you can actually stand beside that partner, help them with their appointments to the hospital, prepare food for them, whatever it is that they need. But I think the most important is for somebody to be there for them. So partners, be supportive of your spouse when they have to go through health issues, because it's not one person. I mean, the psychological aspect of it is when somebody has somebody supporting them, it makes healing and recovery easier and maybe speedy too, in a way.
Fantastic, thank you. There's this saying that says that heaven help those who help themselves.
Yeah.
How can women in that situation that we're talking about help themselves?
I think being motivated. Because like I said before, when people hear, even just having hypertension, people think that that's the end, but you have to be proactive. There's something that you can do, right? So if they say you have hypertension, you need to exercise. You're going to have a better quality of life. All you have to do, stop overeating, cut out salt. So you have to be proactive. It requires some sort of action. You have to help yourself, right? In order for somebody to help you. So you have to be proactive and take actions towards making those changes.
And also, I also want to say that, is when you go to your doctor, especially we talk about hypertension, but also diabetes. A lot of women go around with high A1C that is way, way high, and they don't know it until it's too late. So go to your doctor. When they find something, it's never a death sentence in that moment. It's you taking the next step of how am I going to do it? What am I going to do next? And you work with your doctor, work with your family, find a supportive group. Usually they will give you like a flyer where you can find supportive group online, and you can find people who also are going through exactly what you are going through, and you can relate with them, you can talk to them, ask them questions, and that will also give you some motivation for living.
Wow, I'm so blessed learning all this, and I pray that the women out there will take the best advantage of what we are discussing here.
Yeah.
The question is, how do you handle or how do you counsel women who get involved in non-disclosure or who are scared of what's supposed to be found and they don't do anything? They are hoping for the best. How do you help such women?
I think our society, right, as Nigerians, we dwell on just being secretive about a lot of stuff, especially with chronic conditions.
So we ascribe it to the enemy.
Exactly. Sometimes it's not somebody from your village. This is what you have. So, speaking up about what you have, it doesn't make it worse. You don't know where your help is coming from. You don't know where you're going to get a release from by just talking to somebody about it. And it's not a cloth of shame, right? It's not a cloth of shame. Everybody has something that they're dealing with. So yours is not any different. You don't want it to happen to you, but it's here. So what do we do about it?
So, Mom, there's a lot of junk food out there.
Yeah.
Can junk food, any form of junk food, contribute to this
Oh,
we're
yeah.
talking
Yes.
about?
Oh, yeah.
If so,
I mean,
what kind of junk food are we talking
As you
about here?
grow older, we need to be smart about our eating and our habits. We need to avoid anything. I mean, salty food is just bad enough. Canned food is bad enough. You have to kind of, nobody's saying you shouldn't eat what you want, but you need to kind of manage
Moderation.
what you eat. Eat healthy, try to gluttony is a sin too. Try to find balance in what you eat. When you're not hungry, you don't eat, okay? When you're hungry, eat something that will fill you up without necessarily just filling up calories. Avoid unnecessary cookies, unnecessary junk food. We know sometimes you need to eat junk food because you are busy on the road, but do not make it your routine. Find time to actually selectively pick your food by checking the calories of the food. Check the nutritional content. If you feel the nutritional content of your food that has sugar as a first one, then it's probably not good for you. So you need to just be intentional about, and we live in a very civilized society
I
where you
love
can
that. Be intentional.
Yeah, you can read the nutritional content of what you are eating. So if you look at it and you can see it that this is completely not good for me. If you're going to be eating a bite of cookie that is about 1,000 calories, that's bad for you because you only need like 2,500 calories a day. So measurement, portion, and also being intentional and also being careful. It's also very important when it comes to choosing our diet.
Wow.
Yeah.
Now, another question is this, which is very significant. If a woman discovers that somebody along a line, a mother or grandmother or a relation, has had one of these things that we're talking about, what should she do?
So, do you want to go?
Go ahead.
Okay. So that is why when you go for your first screening, they always ask those questions so that they will follow you closely. They'll follow you closely. Your appointments and your checkup will probably be closer together than somebody who doesn't have that history. So it's a good thing that you know. And it helps you to plan your life to have a different outcome than your family member that had it in the past.
Well, thank you so much. Last question. What is the place of spiritual management of prayer and the things we're talking about here? First of all, I know you're a Christian, right?
Yes, I am.
You're a Christian also. Praise God. So, go ahead.
I think, Pastor said, I know God. I know what his expectations are for me. But just because I know God doesn't mean I'm going to live recklessly, right? So it's all about intentionality. But you have to trust God and also live a healthy life. So it goes hand in hand. I cannot drive 100 miles per hour and say, okay, I know God is going to do. No, I'm going to get into big trouble.
Yeah.
And the Bible also mentioned us like the temple. Our body is the temple of God. So we have to use our body wisely. This body will fade away sometime. So we have to be intentional about taking care of that body that God has put in our care. So part of it is being intentional about what the outcome of my body looks like. What do I look like? And what am I doing to my body? So trust God, but also take care of yourself.
Praise God. So, viewers, we have had it all. The only thing I need to add is that the Bible makes it very clear that we are in this world, but not of this world. If we are in this world and we are still in flesh, you better take care of your flesh. Because everything you do on earth, exercises, what you eat, the tension, the pressure, the anxiety you put yourself through, more or less weaken your defenses. So our advice is that let's live defensively, health-wise. Let us pay attention to things that we need to be ashamed to, because God does not make a mistake. Give us medicine. Take the best use of it. God bless you.